Okay, hi, my name's Kionda. I'm going to be doing your abdominal exam today. We're going to be working on a series of tests. Do you give me permission to do your test?
Yes, I do.
Okay, and I've washed my hands before I've actually came in to do your exam. What's your name?
Jake,
Okay, and how old are you, Jake?
18.
Okay, now, in order for me to complete this exam, I want you to get nice and comfortable here on this bed here. And like I said, we're going to check your abdomen. We're going to be looking for masses. I'm going to be listening for some abnormal sounds and different things like that. So right now I'm just kind of just inspecting your skin just to make sure you don't have any scars or anything present. The only thing I note is as a tattoo up in your right upper chest there. You don't appear to have any yellow skin, but let me take a look at your eyes. Okay, those are nice and white, no issues with jaundice here today. So now that we're finished inspecting, I'm going to now take my stethoscope and I'm going to listen for the presence of your bowel sounds, and I'm going to listen to all your different types of arteries. So right now I am listening in the left upper quadrant for his bowel sounds. Now I'm listening in his left lower quadrant for his bowel sounds. And now I'm listening in his right lower quadrant for bowel sounds and our brutes. And now I'm listening to his right upper quadrant for his bowel sounds and any brutes or thrills that I may hear. And I hear positive bowel sounds. They're actually normoactive. So let's take a listen to all of your different types of arteries. So up here, I'm going to listen to your aorta. Okay, I don't hear any brutes there. Now I'm going to listen to your right renal artery. And now I'm going to listen to, this is your left renal artery, excuse me. And then now I'm going to listen to your right renal artery. I don't hear any brutes there. And now I'm going to listen to your left iliac artery. And I don't hear anything there. And we're going to slide over here to the right iliac artery. And then now we're going to move a little bit further down, closer to your right leg, a little bit above, still in your right lower quadrant area, and we're going to listen to your right femoral artery to make sure I don't hear any abnormal sounds and you don't have any brutes that I need to be aware of or anything pulsating. And the same thing with your left femoral artery, listening for any brutes, abnormal sounds, or anything pulsating, which everything all appears to check out. Okay, so now you're going to feel me tapping all over your belly and your different quadrants, and I'm going to be feeling for two particular organs. One's your spleen and one's your liver. So let's start tapping. So over in your left upper quadrant is going to be your spleen, and I don't feel anything normal here. Checking your left lower quadrant, checking your right lower quadrant for anything, and then up in your right upper quadrant is actually going to be your liver. Okay, so I didn't feel anything abnormal there. So now I'm gonna do two different types of palpations. I'm going to do a light palpation and I'm going to do a deep palpation. So with light, I'm going to use one hand and I'm going to be palpating for your liver and your spleen, as well as your in your left lower quadrant and your right lower quadrant. So let's check the spleen. If you can just take a breath in for me. Okay. And then if you can do the same for me to check your liver, take a breath in. Go ahead. Okay. So now let's just palpate. See if I feel anything. Okay, I don't feel anything, any pain or anything.
Nope.
All right, take a deep breath in while I check that spleen again. Okay, let's check that liver, anything? All right, and I can feel your liver at about 5 centimeters. All right, any pain?
Nope.
These other quadrants, okay. All right, so next we're going to check for a series of different types of specialized tests. I'm going to first check to see if you have any ascites, and we're going to do that with the wave test. So I'm going to need your help. If you can just take one of your arms and just place it right there for me. All right, and I'm just going to do a fluid wave. All right, okay, I don't notice any fluid shifts here to the other side, so that checks out good. We don't have any ascites going on. Next, we're going to do a test called the Rosevik sign, and that's a sign that I'm going to use to check to make sure you don't have any appendicitis. So what that test is I'm going to actually palpate on the left side of your body in your left upper quadrant, and then if you have pain on your right upper quadrant, then we may have a little bit of issue with your appendix. Okay, all right, so any pain over there?
Nope.
All right, so that's good. So my last test that I want to check, I want to make sure that your kidneys are not obstructed. So with that type of test, I would like to do, it's called a costovertebral angle test. So I just need you to sit up on the edge of the bed here, and I'm just going to do a couple hard taps that meet right towards the middle here. So, all right, anything, and then while I'm back here, just take a palpation of those kidneys there. Okay, any type of pain or anything during that assessment at all?
Nope.
All right, so we're done. I'm done doing your abdominal assessment for now, so you can put your shirt on, and I want to thank you, and I look forward to seeing you in the future.